I am very confident that we will in short order. I am hesitant to give a date, and I think justifiably so, because I don't want to venture a date when I don't have control over the exact timing. Because if you miss the dates, then people lose confidence in you and in the process, and I don't think we should facilitate that. Vaccine storages, the dosage are very small, they're compact, so it doesn't require a lot of space to transport quite a lot of dosages. So that is fine, because we could literally put it in a panel van with the ice pack and the igloo and preserve the temperature. We just completed training about 550 people across the country, nurses primarily, in the public system, and they are going to be administering the vaccine. So each regional health authority has the responsibility to identify the locations where the vaccine will be initially offered, and it will change over time. The persons have been trained so they can administer. The logistics of receipt of inventory management, NHF, transportation, managed between the NHF and the regions. The regions have their own cold storage, central storage, and then they move it out to the parishes and the parishes to the locations. The NHF inventory system is properly secured. It has cameras. First of all, the refrigeration has temperature control that is monitored 24 hours, so the temperature dips, we know. It has cameras that always are monitored. It has, enclosed structures, locks and padlocks, and it has live security. This is not a usual phenomenon. It's a 100-year phenomenon. It therefore means we learn as we go along. But as far as I'm concerned, the public health system, the public health nurses and doctors have done amazingly well to manage this pandemic with the support, with the leadership of the government, the Prime Minister and the team over the last 12 months, where Jamaica has had an enviable record on hospitalization, on deaths per capita, on infection rates, where we have not shut down the economy. So though we have been set back, persons were still and have still been allowed to go to work, unlike other societies that have totally shut down. But we have managed the levers of restrictions as is required to pull back when we thought that things were getting out of hand. Now we're at a critical juncture. We're at a critical juncture because, one, there's some amount of fatigue setting in. Two, there's an economic imperative that many people have to face. Three, some of us have let down our guard and have not been as stringent in observing the protocols, and have not been observing the protocol as they should and we would like. And we're seeing the manifestations of that in a higher positivity rate and community spread. It's not a time to panic, nor is it a time to be calling for what already exists. There is more than sufficient monitoring that's taking place. So what I would say is that we do have a system. It will always require review, and that review will continue to take place. But I can assure the public that we haven't taken our eyes off the ball, which is to overcome the threat. That the government is still very committed and is working in a way where we have to balance lives and livelihood. Now, this particular period is particularly challenging, I will agree, where hospitalization is under pressure. But we are not giving up or appearing not to be able to do anything. We have added significantly more hospital beds, nearly 30% more COVID beds, and are adding with the 2 new wards, with expansion at St. Joseph's, with the field hospital being deployed at Spanish Town. That will put about 133 new beds from just under 400, 370 plus that already existed. That's a fairly large increase. We have issues with our hospitals, and that's why we said to people, don't go if you don't have to. And we have asked the hospitals to put in makeshift arrangements, tents if necessary, so that no Jamaican will be turned away. This is not the first time that our public health system have come under challenges. We had it with dengue, we had it with chickpea, ZICV, and we have managed to overcome. And I think we are managing that process. The final point is that the vaccine clearly is the focus by most people now. Everybody, or certainly a segment of the population, and rightfully so, would like to see the vaccine. The truth is that the vaccines are not as readily available as the perception is being created that it is. The Caribbean region has gotten some gifts. Those gifts were shared amongst a number of countries, and that is a good thing. But no Caribbean country has gotten vaccines to purchase because none has been available. The COVAX facility has just started releasing vaccines. I think 2 countries now have gotten. This is the one that we have signed on to, and we are in a line to get. And we are negotiating with a series of other bilateral partners, manufacturers, leveraging our relationships with the private sector and others to get vaccines. We have to continue to observe the protocol, prepare ourselves, which is why we are here now, showing that we are preparing. So when the vaccine actually gets here, we can deal with it. And I'm very confident that things will get better. I just ask persons to be patient and play their part.